Well, I am thrilled to be here with you all to celebrate the day, World Patient Safety Day. I am a director of the Better Birth Program at Ariadne Labs and have been fortunate to work for many years in Uttar Pradesh with several colleagues at the Community Empowerment Lab, as well as colleagues at the Ministry of Health and Family Welfare and among others. So I'm thrilled to be able to introduce our distinguished panelists, and I think we have a slide set up, and I just want to make sure that that's ready to go. So as mentioned by Dr. Lallu and others, we have a series of presentations that's going to take place over the next hour, and we hope to share with you learnings around the WHO Safe Childbirth Checklist implementation and the efforts that have been done globally, particularly in India, but also in the region and with colleagues in Sudan. So I'm just providing a brief bio for each person so we can get to the panel itself. So we'll have Dr. Azza Farouk Noredinn, who is the Director of Patient Safety at the MOH in Sudan. We welcome you, Dr. Azza. I'd love to hear a little bit from Dr. Azza Farouk Noredinn and her experience in implementing in Sudan. That has been implemented a while ago, and Dr. Azza is part of the WHO Safe Childbirth Checklist Collaborative that was worked with the WHO, and there was some sponsorship at that time. But how's it going now? What has the sustainability been? And we'd love to hear from you, Dr. Azza, about the experience in Sudan.
Well, thank you so much, Dr. Katherine, and it's a pleasure to be here. And good day, everybody. Wishing you all happy World Patient Safety Day. Well, on behalf of my team, I would like to thank CAHU, Ariadne Labs, and their partners for giving us the opportunity to reflect on Sudan experience in implementing the WHO Safe Childbirth Checklist. Well, as you know, the maternal and neonatal health is a national priority in Sudan and most of countries in the similar context like Sudan. The patient safety team at the Federal Ministry of Health, under the guidance of Dr. Aida Taha, which was a former patient safety director, decided to participate in the WHO Safe Childbirth Checklist collaboration in 2014. The pilot was in a form of a pre- and post-intervention study to determine the applicability of the checklist and its effect on healthcare provider practices in the largest referral hospital, maternity hospital in Khartoum, actually in the whole Sudan, with an average deliveries of 35,000 per year. One third of them were cesarean section, and almost 4,000 an average of nursery admissions per year. The intervention included the introduction of the checklist and training of the staff in its use after being adapted to suit our local settings, like making some sort of translation, particularly for the part that concerned with the midwifery practices. As for the pre-intervention phase, almost 400 births, both normal vaginal delivery and cesarean section, were observed before introducing the checklist. The overall practice in cesarean section were better than the normal vaginal delivery. Areas of weaknesses like the partogram use and so on were identified. 2 months later, the post-intervention assessment was performed, and almost we observed a similar number of deliveries. The observation that was the midwives used the checklist in almost 98% of childbirths, and it showed a significant improvement in more than 6% of the nursing practices related to the childbirth. The doctors actually, it's a little bit depressive because their compliance was much less than the nursing. They were using the checklist in almost 15% of normal vaginal delivery. But still there is a significant improvement in almost 80% of the doctors related procedures and outcome. So the introduction of the checklist, despite all challenges during the implementation in our setting, like availability of supplies and high turnover staff and particular physician, the checklist significantly improved the delivery of best practice by healthcare providers in maternal and neonatal care as well. What we are doing now is to bring more support for the implementation through the adaptation and adoption of the checklist by senior level leaders, particularly the maternal and neonatal health society, obstetric and gynecological society in Sudan. And we hope this effort will be crowned with success very soon.
Wonderful. I think it's great, Dr. Azza, that you highlighted that not everybody takes a new intervention up at the same rate. And that's true for all of us, right? Whether we pick up a new phone or a new clinical technique, that takes some time. So time is part of what we need to think about here in implementation. There's a question about companionship and how is that included on the checklist, and whether or not a companion in the labor and delivery room could help encourage the use of the checklist or following the checklist. Dr. Azza, I'd love to hear from your perspective from Sudan on this.
Yes, actually I wanted to add one thing, that in fact
yes,
the use of the checklist actually made a great reflection on the whole system, not only the childbirth practice as well. That's in terms of giving us a reflection on the workforce availability, their training and CPD, and the skill mix, as well as the standard practices in addition to the availability of supplies and so on. So the front liners were really at a hard challenge to implement the checklist, if not all that resources were applicable for them.
Excellent. Thank you so much. No, thank you. That's a great way to think about it. And I just want to take a moment to say thank you so much to our expert panelists for joining in this wonderful discussion from around the world. Literally all time zones are covered right now. And I want to highlight that, of course, this dedication to World Patient Safety Day and your dedication to achieving safe and respectful childbirth and safe and maternal and newborn care is inspiring to me and the work that I do. But I believe that this panel has been helpful in identifying that it's not always an easy road, but it is definitely progress can be made. Again, I want to thank the leadership for inviting me and allowing me to moderate this panel. It's been really a wonderful experience. Namaste.
Thank you. Namaste.
Thank you so much, Dr. Katherine. Indeed, a wonderful session. You know, it's overwhelming to hear from so many experts across the globe and their experiences, the challenges. And from CAHO, as Dr. Anu said, we are the consortium of accredited healthcare organizations in India. We have excellent stakeholder base, quality professionals, doctors, nurses, administrators, who are very passionate about quality and patient safety. So we are sold to the idea of promoting this safe child checklist. And this year we are going to be taking this as our agenda to motivate more and more hospitals join the journey. And we are very sure that we'll be able to promote this in a big way in this country. And as Dr. Anu said, our partnership is growing, and we'll be able to certainly have training sessions conducted across the country. We are really committed to what we are talking about today. And next year, let's all meet together and see the success and where, after 365 days, where have we gone? So that will be a good thing to look forward to. And thank you for sparing your time. Wonderful session. And thank you for all the panelists for sparing your time and your experiences.